think Batman is redecorating the warehouse at this point. I think he's redecorating it with this guy's face. Welcome back for part 2 of Batman fight scene in the warehouse. So you've already seen part 1 and I know you all loved it and enjoyed it, and now we're here back for part 2. So let's continue where we left off. Batman just picks this guy up and literally just smashes his neck and head into the crate. The way Batman does this is pretty much how I flex my muscles on most days. So just look closely here at how the body flexes back on the neck. This is going to result in fracturing of the cervical spine, known as the C-spine, or known as the neck. That flexion completely will destroy the ligaments, the bone, and even the spinal cord at that point. So if you remember from part 1, C3, which is the vertebrae, 4 and 5, keep you alive because they supply the diaphragm, allowing for breathing in, known as inspiration. So like I've said before, this guy is not going to get back up. He will be completely paralyzed. He will not be breathing. He's hasta la vista baby also. He will also have sustained quite a serious head injury, but we're going to come to that in the next scene. I regularly practice this next move in my back garden with a milk crate, and as you can see, Batman has somehow managed to copy me and do this in the film. He has literally thrown this crate into this guy's head, and then the head has then smashed against the wall. I don't think you need a doctor or a specialist doctor in emergency medicine like myself to tell you that this guy's dead. You can see the blood splattered all over the wall, and you can see the acceleration of the crate. Force equals mass times acceleration. So this crate is quite heavy. The force is going to be more than enough to cause a depressed skull fracture to this bad guy. This will result in serious skull fractures, which means break of the skull, will result in serious intracranial hemorrhage, meaning bleeding within the brain, disrupting of the neurons and the brain structure, meaning damage to the brain tissue itself. This will lead to serious brain damage unless somehow there is a trauma hospital, a major trauma center with neurosurgeons on site with an intensive care unit right next to this warehouse. This guy will not survive. Okay, so let's go and watch the next scene. What an amazing fight sequence and choreography going on right here. It's like it was done by myself. Absolutely amazing. There's lots to see, learn, and break down here. So let's break it down into small little components. There's 5 hits to the face using hands and his head to inflict damage and allow himself to regroup to attack these bad guys back. None of these are really heavily impactful. They may cause facial fractures, but they keep fighting, so it's nothing too serious. Similar to UFC and boxing, you get hit in the face, it may cause fractures, it may cause bruising, it may cause some minor tissue trauma, but ultimately these people are still going to be okay to fight and still going to be in tip-top shape. They've got a lot of adrenaline, a lot of catecholamines running throughout their body. They're not going to be giving up that easy. So Batman now grabs this guy's arm and hyperextends it, meaning he pushes it past its normal straightening angle. He shattered this guy's elbow joint. Now you've got different bones here, the humerus, the ulnar, the radius. These are the bones that make up the elbow, the upper arm and the lower arm. This is going to cause serious pain, ligamental damage, damage to the nerves known as the median nerve, the radial nerve and the ulnar nerve. These nerves supply muscles within the forearm and the hand. Damage to the blood vessels, damaging the brachial artery, the radial artery, the ulnar artery. These are big blood vessels that supply the forearm. So like in part 1, this guy also will not be using his arm, and that arm will be completely useless. He'll still have his other arm to use. So it looks like Batman's hit this guy within the area of the liver and the bowels. This can cause different types of damage. For example, the liver, it can cause liver laceration, bleeding to the liver. Hitting towards the bowel area can cause bowel rupturing, meaning that the bowel itself could tear apart, leaking fecal matter, which is your own poo coming into your abdomen, which can cause serious infection later on. So the immediate effect will be serious pain. Stimulation of the vagus nerve. Now when you stimulate the vagal nerve, it will cause a drop in your blood pressure, a drop in your heart rate, leading you to collapse because you can't maintain blood supply around your body. So this is a classic hit used in UFC and boxing and martial arts to disable your opponent. Stimulate the vagal nerve will cause someone else to collapse. So this next guy is so smart, he shows Batman that he's got a knife. I don't think that's a clever move. This guy was an absolute genius. Batman takes it off of him and stabs it back into the thigh of this guy. Now we've covered this before, so let's go through it again. Major vessels run through in this part of the thigh, known as the femoral area. You've got the femoral, nerve, artery and vein, which run from the lateral to the medial aspect, meaning outer to the inner area. So this will cause major hemorrhage, major bleeding, disrupting those blood vessels, the femoral artery and the femoral vein, especially the artery, because it's under such high pressure, you can bleed out within a matter of minutes. And damaging that femoral nerve means that this bad guy will not be able to straighten that knee, meaning extend the knee, and he won't be able to flex at the hip, meaning bend the hip. This guy will be absolutely useless in combat. He's going to need an operation to fix this, and he'll need an operation very quick. So now we've got a head trauma from the punch. He may sustain a fractured nose, which in reality terms we don't do anything about, or he may sustain a fractured jaw. Again, in most cases, you'll be seen in an outpatient's clinic. Nothing needs to really be done about that. We can see the same again in this next one. Now this looks similar in this one, but this guy is also getting his head smashed into the ground. So it's slightly different. I think Batman is redecorating the warehouse at this point. I think he's redecorating it with this guy's face. So we've covered skull fractures and we've covered intracranial bleeding. So I'm going to go through Le Fort fractures, facial fractures that can be sustained in this type of trauma. So let's have a look at the diagram that I've got. You have Le Fort fracture, which is a horizontal fracture through the maxillary area. As you can see in the diagram up here, we have a Le Fort type 2 fracture, which is known as a paradiddle fracture of the face, which goes through the posterior alveolar ridges, lateral walls of the maxillary sinus, inferior orbital rims, and the nasal bones. And then we have a Le Fort type 3, known as a hanging face, also known as complete craniofacial disjunction. Your face is literally hanging off of your cranium. This can cause complete loss of the airway, can cause serious internal damage, and this guy will need maxillofacial specialist surgeons to intervene for this type of fracture, and therefore this guy is immediately at risk. Literally, Batman's finished this off. His head doesn't exist anymore. So now we can see in this one an elbow fracture. Fracture like the previous that we've already seen. Damaging the joint, damaging the vessels, damaging the nerves. But not completely out of action because you've still got the other arm. We can see here a minor head impact, nothing serious. The blades may cut the face, lacerations which can be fixed with sutures. This guy's a bit brave because he stabs Batman in the left shoulder, but I don't think he does a good job because he doesn't know his anatomy. And why doesn't he know his anatomy? Because Batman still kicks his ass. Because in this area of the shoulder and around the armpit, you've got serious major vessels, the axillary artery, which supplies a serious amount of blood to the arm. You have the brachial plexus, which is a complex area of nerves which supply all the motor and sensation, meaning for movement and for feeling, to the arm, and also the lymphatic system, which drain away all the lymphatics for the arm as well. And also it's the area which can also pierce into the lung on that outer aspect. So it can cause a pneumothorax at the same time and damage vessels which lie in between the ribs, known as the intercostal vessels, which can also cause a significant amount of bleeding and damage. But you can see the damage is hardly little for Batman. So this next one is a minor head injury, as you've seen before. An impact to the thigh, causing him to fall quite impressively, but in real life, you wouldn't really fall to the ground like that. Now here we go. Batman is going to get this guy back So what does he do? Stabs him right back. But what is different? Batman knows his anatomy. Batman's done his research because he's watched my videos, so he knows more about anatomy and physiology. Good learning takes place on this platform. So the other injuries that we described earlier on, Batman's caused those injuries to this guy. This guy will not be using his arm, and most likely will probably bleed out and have a pneumothorax. So what Batman has done here, he's temporarily blinded the man, causing a minor head injury and facial injury, which gives him enough time to recoup himself, and he literally grabs this guy and throws him through the wall. This can cause different types of injuries, such as spinal trauma, as we've discussed, and injuries to his chest and his back. But let's be honest, it's a plaster wall. He's gone through it. It's going to cushion his fall. He's not hit anything serious. So Batman really has used a lot of energy, and it's dramatized, and really the medical damage is not going to be that significant. Basically, I don't know what Batman is doing here. I think he's reaching into this guy's heart, and I think he's pulling it out. This is just Batman being pure threatening. I think this is the most brutal Batman that we've seen to date, and he's just taking out on these guys. So we can assume anything from here. Chest trauma, abdominal trauma. The type of chest trauma that this guy could get. Bleeding in the lungs, air trapped in the lungs, known as hemothorax, pneumothorax. Could get a contusion of the heart, fluid sitting around the heart, known as pericardial effusion. That can stop the heart. Damage to the heart can also cause rupture of the aorta, the big blood vessel that comes off from the heart, leading to massive internal hemorrhage, massive internal bleeding. Punch to that area there, he could also be causing significant damage to the abdomen, to the bowel, causing rupturing to the liver, causing significant hemorrhage there, and then also causing significant rupture to the spleen. Now the spleen has a lot of blood that is transported through it, and rupturing that can cause a massive internal hemorrhage as well. And we've got the final scene right here. Batman kicks through the wall like he's Arnold Schwarzenegger in Terminator. Batman knows that his bullet from the gun is going to be much faster than the flamethrower. Knowing that the flamethrower is going to take a few seconds to reach from the start point to where Martha is situated, Batman knows that if he ignites the gas canister and causes an explosion, he'll have enough time to jump over to Martha, reach over, use his protective cloak to protect her, and the burns and the blast injury are going to be sustained by the main bad guy. And remember, this was the bad guy in part 1 who was still brave enough to hang around, whereas if it was someone like me and I saw the devastation that Batman was causing, I would have left my money and wallet and car keys, and I would have said, thanks Batman, but I'm not going to be hanging around today. So this bad guy would have experienced serious trauma to the head, the neck, the chest, the abdomen, the limbs. You could think that he's been completely blown up, in which case it's a major catastrophe and death right at that single moment. Or you could assume he would have had limb amputations. If there aren't cavities in his chest or his abdomen, there'll be severe burns. Severe burns will lead to massive fluid loss. There'll also be blood loss. There'll also be severe infection that will set in. And there'll be severe internal injuries to organs, such as blast injuries, which will cause rupturing of the internal organs, rupturing of internal blood vessels. There is literally no way out of this for this guy to survive. If in the rare circumstance this guy survives, he's going to be on the intensive care unit, needing severe intervention, severe high level of dependency and treatment, long recovery, and there's going to be major disabilities at the end of it. This is not a nice way to go. Well, thanks for watching. I hope you enjoyed it. This was part 2. I've got some other amazing fight scenes and sequences from films that you all love and enjoy coming up. So I look forward to seeing you all in the next video. Please subscribe if you like this video and want to see more content like this.